Welcome to another episode here on Youth Conversation Corner podcast. And today I'm with Miriam Tsoka, a nurse at Queen's Central Hospital. And today we'll be tackling about abortion issue. So, welcome, Miriam.
Thank you.
So, what is abortion?
Abortion is the termination of pregnancy before birth, and by taking medicine or having a small surgery.
So here in Malawi or outside Malawi, why do people consider abortion?
There are a lot of various reasons why people tend to have abortions. For example, personal circumstances, unplanned pregnancy. The first reason is personal circumstances. Unplanned pregnancies are unplanned pregnancy or unexpected. Another example is financial instability. Maybe being unable to support a child financially, as well as lacking of support due to the absence of one partner or a family that can support maybe when the child is born, as well as in career and education, since it concerns about impacting education or the career goals of the child before it is born. Another reason, it can be due to health concerns. For example, a mother's health, since pregnancy can possess a risk to physical or mental well-being. And also, if there is fetal health, like a serious medical condition or some abnormalities that that a mother can have during the pregnancy, or maybe in cases like rape, since pregnancy results from sexual assault, it can sometimes be assumed as like a sin, so people tend to have abortion. Another reason is emotional and psychological factors. These factors can be emotional readiness, which is feeling unprepared for parenthood. Also, mental health, which concerns about managing parenting responsibility. Another example is relationship issues. Maybe unstable or unhealthy relationships. This can lead to emotional and psychological factors. The other reason is social and cultural factors. For example, social stigma, which is fear of judgment or fear of judgment. Another example is cultural or family expectations, maybe due to conflicting values or pressure. And also access to resources like limited access to healthcare, education, as well as support. And other small reasons can be age, maybe due to teenage pregnancy or advanced maternal age, or multiple pregnancies, maybe carrying twins or multiples, as well as previous traumatic experiences, which is a past trauma or a loss. Those are some of the reasons why people conduct abortion.
So, what are the different types of abortions that many people experience or consider?
There are many types of abortion, and the first one is medical abortion or abortion pill. This is done up to 9 weeks of pregnancy, and also it involves taking 2 medicines at once, and the stopping of pregnancy. These medicines stops pregnancy growth, as well as it causes uterus to contract. And also the medical abortion, it ends pregnancy without any surgery. Another type is vacuum aspiration. It is done up to 15 weeks of pregnancy, and it involves inserting a tube into the uterus using suction to remove pregnancy tissues. Yeah. And this quick procedure is done up to from 15 to 30 minutes. The other method, the other type of abortion is dilation and evacuation. And it is done between 13 to 26 weeks of pregnancy. And it involves dilating the cervix, removing pregnancy tissues with the instrument, and also it may require multiple visits for it to be done. And the other type also is dilation and cartilage. It is done to 16 weeks of pregnancy, and it involves dilation the cervix as well as scraping the uterus running with the cartilage. And it also often used for miscarriage or early abortion.
So have you or someone you know experienced abortion?
Okay, yes, I have one of my friend who once have an abortion, and this came as a shock to her. Even maybe her parents were ready to chase her out from the house, and then rather she didn't have anywhere to go. Then this resulted into a lot of confusion in her mind. Then she decided to take maybe suicide, but due to some support that she received, she ended up being saved. Okay, and I as a nurse, I've also met with a lot of people who come to have abortions. Yeah.
So what support did they receive?
These people need to have a lot of support, like emotional support through partners, families, friends, maybe counselors or therapists, support groups, and other people.
What then? Any support? It's only that?
No, the other support also is medical support. Maybe healthcare providers like primary care physicians, as well as abortion clinics or facilities, hospitals, and telemedicine services. The other support is also practical support. This is financial assistance, such as insurance coverages, and for example, also the transportation to appointments, child care or family care, and accompaniment to appointments. Not only that, we also have other supports like information support. These are outline resources such as Planned Parenthood, American College of Information support, as I've already said, is another support. This is the online resources such as Planned Parenthood and the education materials such as pamphlets, videos. This can also help. And the healthcare providers consultation as well as abortion counseling services. And the last support that these people can reach to is also post-abortion support, which is the counseling or therapy support groups, online forums or communities, as well as post-abortion support hotline.
So what are the medical risks of abortion?
There are a lot of medical risks that comes due to abortion, such as surgical abortion risks. Surgical abortion risk can lead to infection of uterine, cervical, or pelvis, as well as bleeding heavily or prolonged, damage of surrounding organs such as bladder and bowel, cervical restoration or perforation, uterine perforation or rupture, adhesion or scarring, as well as reaction to anesthesia. The other risks is medical abortion risks. Due to the incomplete abortion, as well as heavy bleeding or medical abortion risk or abortion pill is also the other risks that people who have abortion face. This will result to incomplete abortion or tissue remains, heavy bleeding or hemorrhage, infection, allergic reaction to medication, severe abnormal pain, nausea and vomiting, as well as diarrhea or fever. The other risks are general risks such as emotional or psychological distress, blood clots or thrombosis, cardiac complication, respiratory problems, as well as death. And long-term risk is also the other risk that abortion people can face. This can result into infertility or reduced fertility, as well as future pregnancy complications, increased risk of ectopic pregnancy, as well as potential impact.
So how does abortion affect mental health?
Abortion can vary effects on mental health depending on the individual circumstances. And here are some of the balanced overview. The first is a potential negative effect, such as the emotional distress, anxiety, depression, guilt or shame, as well as the relation issue. The second one is factors increasing risk, such as lack of support, pre-existing mental health conditions, traumatic experience such as rape, as well as cultural or societal stigma. The third one is potential positive effects, such as relief, reduction anxiety or stress, increased sense of control, empowerment, and improved mental health, especially for those who felt pregnancy was and the other one is long-term effects. Most women do not experience long-term mental health issues, and some may experience persistent emotional or psychological distress, but and also risk of depression, anxiety, or other multiple abortions.
So, what are the alternatives to abortion?
Alternatives to abortion depend on individual circumstances and preferences. Options are pregnancy options like parenting, such as raising the children to oneself, adoption, like placing the child for adoption with another family, as well as foster care, which is temporary care for the child until a permanent arrangement is made. The other alternative is support services, financial assistance such as financial assistance, and also housing and food support. Counseling and emotional support is also a must, as well as parenting classes and education. The other alternative is adoption options, maybe opening adoption, which read out to maintaining contact with the child and the adoptive family. Closed adoption, maybe no contact with the child or adoptive family, and the semi-open adoption, which is limited contact with the child and the adoptive family. The other fostering care option is also the other alternative, which is a short-term foster care, like a temporary care until the child parents can care for them, and also long-term foster care, which is a permanent care until the child reaches adulthood, and the kinship foster care, which is the care provided by relatives or family friends. And other normal alternatives can be safe haven laws, which is allowing parents to anonymously surrender their infant by state, as well as temporary custody, by allowing parents to temporarily take custody of the child, as well as the guardianship, which is transferring legal custody to another adult.
So, should abortion be legal?
The legal of abortion is a contentious issue with opinions divided globally. The pro-choice advocates argue that women have the right to control their bodies, reproductive choices, and the autonomy. And they also emphasize the importance of safe and the accessible abortion services, citing reduced maternal mortality and the health complications. Anti-abortion or pro-life support believe that life begins at conception and that abortion takes an innocent life. They also advocate for restriction for complete bans on abortion, except in cases of rape, incest, or maternal health risks. Ultimately, the decision to legalize or restrict abortion depends on societal value, cultural norms, as well as the interpretation of human rights.
So, what role does religion play in abortion decision?
Religion significantly influences abortion decision for many individuals. Some faith like Catholicism and certain evangelical denominations strictly oppose abortion, viewing it as a normal equivalent to taking a life. Others, such as Judaism and some Protestant denominations, may allow for abortion in specific circumstances. Based on faith and spiritual beliefs can guide individuals' choices, often intersecting with cultural, social, and familial factors. However, not everyone's decision is driven by religious conviction, since healthcare providers and policymakers must respect diverse perspectives and ensure access to care regardless of religious affiliation.
So how do you think we can reduce abortion rates? How can you reduce?
Okay. Abortion rates can be reduced by addressing a lot of factors or strategies, such as improving access to comprehensive sex education, increasing availability of affordable contraception, enhancing healthcare services, including prenatal care, supporting economic stability as well as education, encouraging open discussion about reproduction health, and promoting healthy relationships.
Okay, so what support systems are there for those who are affected with abortion?
There are a lot of support systems for individuals that are affected by abortion, such as counseling services, hotlines and hotline and online forums, support groups for women, partners, and families, medical care and follow-up services, financial assistance programs, legal aid and advocacy organizations, as well as faith-based organization for those seeking spiritual guidance.
So how can we promote informed discussion?
Informed discussion can be promoted through respective dialogues, like by listening to diverse perspectives, accurate information and data-driven research, including language, avoiding stigma and judgment, media representation and storytelling, education and critical thinking, and also encouraging empathy and understanding.
So what's the future of abortion rights?
The future of abortion rights is uncertain, with ongoing debates and legal challenges. So these are factors influencing the landscape. The first factor is shifting public opinions and demographics. Also, legislative, judicial decisions, global human rights advancement, advocacy efforts and grassroots movement, and also medical and advancement and technology.
Advice. So do you have any advice for those people who are trying to do abortion or they are already did it?
Yeah, I have a lot of ways to say, but I just mention a few of them. These people need to make sure that they go to clinics that are specialized or that are very much that they very much know about abortion, since they can end up ending their own life by deciding to not choose a proper hospital for them to do the abortion. And also they should just follow up measures just to avoid pregnancy, like maybe unwanted pregnancy, by doing a lot of maybe abstaining from things that can lead them to those to that stage. Yeah, so those are some of my ways that.
Okay, thank you. So this is the max end of today's program. Thank you for being there. Bye until next time.